Good morning, Kansas City. Good morning, Kansas. Good morning, Western Missouri. Good morning to all of our listening audience out there today. We are so happy to have you here. This is Steve Stites, Chief Medical Officer at the University of Kansas Health System, broadcasting live down in the Dolph Simons Family Studio. I got all the way through the introduction this morning. That's pretty awesome. I only stumbled on one word, but I got it out, so that's pretty darn good. I am joined this morning by Dr. Dana Hawkinson, Doc Hawk, Medical Director of Infection Prevention and can't get through that one. Infection Prevention and Control, and Alan Greiner, who is one of our outstanding family medicine faculty and is the medical director for Wyandotte County. And so excited to have Alan back with us today because we talk about reopening and what's going on out there and lots of news. We are also joined and honored again to have Senator Jerry Moran, who has been with us for a number of Fridays. And Senator, are you back in the basement again? I have to ask, as I know I think you spent a lot of time there.
I made it to bed last night at midnight in Kansas, in the basement. You are correct.
Excellent.
And every time I get off an airplane, it starts all over.
Well, you're probably safe down in the basement, so that's okay. Before we jump to some questions and talk more to the Senator, I do want to visit with Chelsea Smith. Chelsea is an outreach and communications coordinator with our Community Blood Center. Chelsea has a really important message for us today. As you know, the Community Blood Center is a primary supplier of blood products to our area. And for those of you who have done it, have given blood before, they do just a remarkable job. And those blood products are essential to healthcare. The Community Blood Center needs about 600 units a day, and there's a shortage. And I think that the Community Blood Center is suffering from some of the same things, with people being afraid and people not knowing necessarily the need for it. But wow, with this COVID crisis, there is a significant need. Chelsea, talk to us a little bit about some of the things that the Community Blood Center could use help with from our listening public, and things we need to do to make sure we help keep our blood supply healthy and safe.
Yeah, absolutely. Thank you guys for having me. I appreciate being on. We did issue an urgent need for blood donations last week. We use the word urgent. We've used the word urgent a lot. We have seasonal blood shortages in the winter and summer months especially, but this is actually quite different. We don't really have a word for what this is. We have been staying afloat over the past several months as hospitals have been kind of cutting back on their blood usage. But of course, May came around and our community started to open up again and hospitals began resuming normal operations. So basically overnight, the demand for blood products doubled. However, we're still limited in our capacity to collect as businesses, schools, churches, they can't hold blood drives with us right now. So we're working diligently to try and get back out into our communities. We're still maintaining our 7 donor centers across our entire service area, which includes Topeka and St. Joe, not just Kansas City. But the need is dire. We usually like to have a 7-day supply, a 7-day supply of blood products across all blood types. Right now, we're down to about a 2-day supply. It's the lowest it's ever been, and it's quite alarming. So the need is great. We need donors to hear this message, to come in and know that their community needs them now.
Chelsea, is it safe to give blood?
Yeah, absolutely. So we have been implementing, as most businesses over the past several months have been implementing safety protocols that include face masks. They're being worn by donors and staff at all times. I am actually in a room by myself, which is why I'm not wearing a face mask. Just want to clarify that. Also, donor temperatures and staff temperatures are checked at the door. We are constantly disinfecting in between each donor. Anything that a donor touches, we're coming right behind them after they leave and disinfecting that before the next donor comes in. We're doing our due diligence to make sure that these blood drives and that our donor centers are safe and controlled environments for our donors to come in. This isn't a place where you should worry about contracting COVID-19. Healthy donors only should be coming in here, and we are doing our due diligence to make sure that we are preventing the person-to-person spread of this disease.
Well, I think it's really important for us to all recognize how vital this is for our loved ones and everybody, our friends and family, because the blood usage could spike, especially over Memorial Day. There may be less traffic, but there are traditionally a lot of accidents, trauma, etc., and that requires a lot of blood over this weekend. So good luck with that, and we'll make sure that we'll help you get that message out as much as we can, because this is really a big issue. And as an ICU doctor, I know how often we do have to rely on blood products for the critically ill.
We have one question for her. It's from a viewer. Can someone 74 with chronic heart and lung disease donate blood? I don't take blood thinners.
Chelsea, what do you think?
Yeah, that's a great question. So we don't have an upper age limit on blood donation. So if you're healthy, if your doctor approves that, you're welcome to come in and donate. If you have specific questions regarding maybe a medicine that you're taking or something along those lines, you can call our medical eligibility hotline, which is 800-688-0900. And we have a medical team on standby to answer any questions that you might have.
They can access that information on the web as well, and if they just go to the Community Blood Center to your website. So will you take a 60-year-old who's kind of losing their hair?
Absolutely, we will. Yeah, again, a lot of people can assume that they are not eligible to donate blood for one reason or another. And actually, most of those reasons are myths. There are very few reasons that defer you from donating blood. So we do encourage that if you have questions, give us a call. You can go to savealifenow.org and you can find more information regarding medical eligibility there as well.
Oh, that's great, and I'll try and sign up for next week myself. I have a gallon pen, but I bet I can do more now. So thank you for all you do.
That's great. Thanks.
I'm going to turn to Doc Hawk for just a minute. Doc, how are we doing this morning?
Good.
What are numbers like?
Our numbers are 20 today. So I think yesterday we were 14. We have 20 in the hospital today. 8 of those are in the ICU, and 4 of those patients are on ventilators.
So we have ticked up just a little bit.
Yeah.
We have been under 20 for a few days, back to 20, and we'll keep a close eye on that. But it may be a little bit of a rise, maybe reopening, may not be, because we have a lot of variability just from day to day anyway.
And now that we're testing everybody, so certainly we are maybe getting some of those asymptomatic or pre-symptomatic patients. And I would like to say that certainly the Community Blood Center mission is phenomenal. We have people all around the nation who are willing to help in various ways. There are people who are willing to get infected with COVID so that they can do the vaccine trials, or in the vaccine trials understanding that they could get infected with COVID. We have people who are willing to donate plasma after they have been infected with COVID as well. And so I know that there's a lot of people out there who want to donate blood and blood products, and so that's a good thing.
Yeah, it is a great thing. So Senator Moran, welcome back again this morning. I'm sorry you're down in the basement. I'm beginning to think you have a man cave down there. Is this true, or is it you're really banished downstairs?
The reality is that one could never admit, no husband should ever admit that they're just fine in the basement. No, it's a terrible experience. I can't wait to get back to the normal life throughout my house.
How are things going today, and how are things back in D.C.?
Thanks for letting me join you again today. I arrived, as I said, from Washington, D.C. last night and back in Kansas, so away from D.C. for Memorial Day weekend. And looking forward to a conversation this morning about how we can celebrate those who served our country despite COVID-19 being in our presence. So I'm glad to be with you. We continue to work on ideas for what may happen legislatively next in the nation's capital. We continue to have oversight hearings on things that we've already passed, legislation that has already been enacted and is being utilized across the country. What's working, what's not working, where are the mistakes? And so the United States Senate is in part doing its work. I appreciate being here always to have conversations, mostly to be able to listen to what the rest of you are saying. And already I appreciate what Chelsea said. I've been promoting something I learned in our conversations here in this press conference about the safety of hospitals and clinics across Kansas. You've indicated the University of Kansas health system is one of the safest places, more safe in regard to viruses and infections than even before COVID-19. And the reason that is important, people need to access health care. It is important as we open our economy. One of the things that we've been struggling with, and we've talked about in these press conferences on a frequent basis, is the financial condition of many of our rural and community hospitals, as well as clinics and doctors' offices. And as we open up, if those places are safer than they were before, safe places for people to be, it means that people can access health care and our healthcare providers can start generating revenue to keep them in business. It is a reminder what Chelsea said is that I talk about utilizing healthcare services across Kansas. I also need to be promoting the idea that we can donate blood and help the system. And I hadn't thought about the fact that as more people return to more routine care and there's more activity, as you said, Doc, there's more accidents, that blood becomes even more important and unfortunately scarce at this point in time. So, Chelsea, you caught my attention, and I'll do what I can to promote the idea of blood donation. And Hawkeye, Doctor, you said something, testing everybody. That caught my attention, and I don't know exactly what that means at the University of Kansas when you were talking about your statistics. But glad to be with you and have a few things I'd like to talk about at the appropriate time about what's going on in regard to COVID-19 and veterans and military men and women in our National Guard.
You bet. Well, let me turn. I'll come right back to you. Let me just turn to Doc Hawk, and we are testing all admissions that come in now.
Yeah, please let me clarify that. So before, we were just testing our patients that came to the hospital that had symptoms of COVID-19. As we started to reopen up our operations, we started to pre-screen surgery patients 1 or 2 days before their surgery for a patient safety issue to make sure they weren't infected, because an infection and surgery is higher risk for complications. Now, anybody who comes to the University of Kansas Hospital is going to be tested as an inpatient, just so that we can understand, are you asymptomatic, are you carrying the disease? This is for protection of you as well as for protection of our healthcare workers. So any inpatient admission now will be screened by testing with the PCR test for COVID-19.
We know that our percent positive patients. Sorry, go ahead, Senator.
I was just going to say, Hawkeye, I participated in another press conference. You guys have increased my press conference availability, but with Heart to Heart, headquartered in Kansas City, who received a CDC Foundation grant related to testing, and I know it has something to do with the University of Kansas Hospital.
Yeah, and I think we could probably have Alan Greiner. Alan Greiner, who's I got his official title here. He is the medical officer for KCK, Wyandotte County Unified Government. Takes a long time to say all that. He helps run the county health department for Wyandotte, but he's really involved in some of the work that's being done here locally as well as with the state of Kansas, because I know that you've worked constantly with Lee Norman and KDHE. Talk to us a little bit about Heart to Heart, because that's something you picked up early on, I think.
Well, yeah, we've been trying to push testing since the very beginning of the outbreak here in Kansas, since really the very first cases here in Johnson and Wyandotte County. And Heart to Heart International was part of a team that started volunteering at some of the very first drive-through testing sites, but they also had applied for that grant you mentioned, Senator. And so there's several faculty here. Kevin Sykes from the ENT department is intimately involved in their work across the metro to do their testing, and then Dr. Aaron Corvo and myself have also been involved, and we're trying to see how much of that testing we can get to happen here in Wyandotte County, because that's kind of our focus, but really it will be going on across the Kansas City metro in the coming days, and there will be a whole lot of tests performed that I think will really help us on the public health side know what's going on.
Yeah, it's a pretty big effort. And Senator, thanks for your support in doing that, because we think Heart to Heart is a great organization. They do great work. And also, Senator, for your support of our community blood banks, because, Chelsea, again, we know how important that is. As you look forward, Chelsea, just to think about 2-day supply isn't very long. Are you able to have community blood drives over Memorial Day weekend? Can people still come in and donate even over a holiday?
Absolutely. We're open. So if you go online, we have all of our blood drives that are going on in the community. They're listed online. You can actually search via zip code to find locations near you. But we do have 7 donor centers that are open 7 days a week. We are open on Memorial Day. And so if you want to go online, make an appointment. That's something I didn't mention before. We do strongly encourage appointments right now because it helps us control the number of people that we're seeing in the building at one time. So walk-ins will only be accepted if we're able to accommodate those. But yeah, we've got blood drives, we've got donor centers running all weekend.
Specific blood type that you know is especially in short supply, or is it just kind of across the board?
Honestly, it's kind of across the board, but we always want to point out our O blood types because those are used most often in emergency situations. So we're running pretty low on O neg right now, a little low on O pos as well. But like I said, across the board, we are under a 7-day supply on all blood types. So it's pretty urgent.
All right. Senator, you mentioned a little bit about our veterans and COVID-19. Do you want to go ahead and pick that up?
Well, thanks. I would indicate that I chair the Senate Veterans Affairs Committee. I've been involved in I'm not a veteran myself, so I don't claim that distinction or honor. But I have tried to be involved, particularly in the health care of veterans, since I arrived in Congress, and in large part coming from representing a congressional district that's 2/3, 3/4 of the state of Kansas, about the same size as the state of Illinois when I was a congressman, no VA hospital. And so we've been working for all these years trying to figure out how we get more veterans cared closer to home across the state of Kansas. And as a result of that interest, I've over time and seniority have become the chairman of the Committee on Veterans Affairs in the Senate. I would use this opportunity to pay great regard and respect, express gratitude to those who served our country, who are serving today. We have lots of individuals serving, particularly in the Guard today, specifically related to COVID-19. The Guard has been mobilized. We worked hard to make certain that they get the federal care and treatment, the benefits under Title 32 for their service here in Kansas, so that it counts toward their service and retirement and benefits in the future. But I would express gratitude, especially as we talk about COVID-19 in this press conference, to those members of the National Guard across Kansas who are doing many tasks related to trying to get COVID-19 under better control. But I would also say that, for example, we've been successful in passing legislation to allow the GI Bill to apply and be available to students who no longer can be in the classroom and are now being educated online. That was something that they wouldn't have qualified for GI benefits prior to this. And so just in many ways, kind of small things that people don't think about that maybe Congress has the capability of working on and getting accomplished, but are not small things to a veteran who's on the GI Bill, but their university that they're at or has eliminated the program, or those classes are no longer available in the classroom, but only online. Those GIs can still get their benefits that they are entitled to and have earned. We've even tried to increase and have had some success, I think, in increasing the opportunities for the VA to do telehealth. They are known for telehealth, and we need greater, in all aspects of our education and healthcare life, we need greater connectivity across the state of Kansas. So just kind of things that for our veterans that are disabled, receiving a disabled benefit from the VA, they needed special legislation. That's not the right word of saying that. They needed legislation to clarify that they were eligible for the economic impact payment. That's the direct check, the $1,200, even though they may not have filed a tax return. And we were successful in getting that accomplished with working through the VA and the Treasury Department. So lots of things related to veterans. I would say that perhaps one of the successes we've had just in the last week is the passage by the Senate of the 988 hotline bill for mental health and suicide prevention. We decided that we need one national number in which somebody who has need of a hotline service, and it's not just for veterans, it's for everyone, but we've seen an increased suicide rates by veterans, and it is my top priority in overall efforts at the Senate Veterans Committee is to better improve mental health services and reduce veteran and military service men and women's suicide. So we're at work in that regard, even with COVID-19 dominating the news. While some of the things we do are related to COVID-19, they are related to veterans in every aspect. And I would just use again this Memorial Day weekend to express gratitude to veterans, to military men and women serving today, to honor those who died in service and to pay respects to their family. It'll be a different kind of Memorial Day, not many gatherings. I've got a couple of things I'm going to be doing on Memorial Day, but they're all virtual. Although I have one opportunity to place flags at veterans' graves in a community cemetery in which we each have our own section of the cemetery and will be socially distanced.
Yeah, so important because we do have to keep following those rules of infection control and prevention, Alan. Work being done in Wyandotte County around the Phase 2 reopening. Talk to us a little bit about that.
So I'm going to whip through some slides real fast. Logan, if you want to pull those up. So thank you for having me again, Dr. Stites. As you know, I've kind of got my foot in two worlds with what I'm doing these days. Most of the time I'm over at the health department in Wyandotte County. Sometimes I'm here. Now that we're seeing some more patients, I'm here a little more, and I'll be with you guys actually in the hospital next week. So trying to juggle all these things. But as you all know, a lot of this is watching numbers and data. And this first slide really shows some of the different counties here in the metro compared to the state numbers and the rates of cases that we're seeing. We're working on a phased reopening in Wyandotte, as the whole state is right now. And we really are seeing improvements in numbers. As you mentioned, Dr. Hawkinson, our hospitalization numbers, although they bounce around, they've stabilized somewhat at lower levels, which we think is good. But we're still worried in Wyandotte about this rate because our rate of 734 per 100,000 is quite a bit higher than the other counties here in the metro and quite a bit higher than the state rate. We've also had the most deaths in the state at 43 per 100,000 as compared to Johnson County, for example, that's only got 10 per 100,000. And even though we're seeing spikes in cases in places like Ford County, Finney County, Seward County, where the meatpacking plants, the big meatpacking plants are, as well as Leavenworth with the incarcerated populations, our hospitalization rate tends to be quite a bit higher. So right now, we've had about a 10 times higher hospitalization rate than Leavenworth County, our neighbor, that's got actually more total cases than we do. Logan, next slide shows kind of how we're monitoring change over time. We're looking at these 14-day moving averages, and this is Wyandotte County showing our 14-day moving average of new positive cases. You can see we got pretty high there, but we're really pleased that that's coming down, even with some of the phased reopening activities that are going on. Again, if people can maintain those different behaviors regarding social distancing and other things, which we'll talk more about, I think we can continue to control this. Logan, next one, please. This is the rolling averages on deaths for our county. As I said, our rate's been relatively high compared to neighbors, but you really can see here that we've come down from the real peak we were at a few weeks ago, almost a month ago. I think the number of people recovered, especially if you watch our hospital numbers here at the health system, are really pretty amazing and impressive. And we don't want to scare people to think that this disease is always fatal. If you're getting out and getting tested early and you're engaged with a health system, especially one that has those critical care and emergent services like we have, we really think we can keep this thing under control. And so the testing, like we mentioned with Heart to Heart, Walmarts are testing now in our county. We're still doing it every day at the health department. That stuff is super important. Next one, Logan. The percent positivity is really important to us too. So even if those numbers and new cases keep going up as we're doing more testing at all these sites, if the number of positives out of the total number we test goes down, that's a really good sign. It was really high for us in Wyandotte there for a while, 30, 40%. We even spiked up around 50 at one point, but it's come way down in the last couple weeks. Now, some of that is all the testing we're doing here now, which for the elective procedures and the new admissions, we're doing a lot of tests, so that positivity rate's dropping. But that's what should be going on. We need more tests happening. As a state, we're still not meeting the sort of benchmark numbers of about 100, maybe even 200 tests per day per 100,000 people. We're really trying hard and have some great partnerships on that, but we've all got to keep working together on that. Next one, Logan. I got one little table here that's kind of a teaser for next week, looking at racial ethnic data on death rates. That's a big concern for us. It's going to be a concern for everybody around the country that takes care of a diverse population. We take care of a real diverse population here at the health system, as well as a very complicated population. So we're going to have to keep watching this and trying to figure out ways to get these rates more in line with what our population demographics are. The bottom table there in the bottom right just shows you how dramatic the age-related issues are and how important it is for our vulnerable older populations to keep paying attention to the stuff we've been talking about for months. If they don't stay at home, if they don't, and I don't want to blame anybody for anything they do, but it is time for us to work with all our friends, neighbors, relatives that are a little bit older, as well as our patients, to encourage this message that we've got to be careful or we're going to have more hospitalizations and deaths. I think I have a couple more, Logan. The next one shows you our Restart WyCo initial plan. We had a plan in place to do this sort of red, yellow, green phased reopening. We were in red, and we just moved actually today. We were going to move into yellow, but we found that our yellow phase was really pretty much the same as the Astra Governor Kelly plan, which is going to allow things for us like barber shops, salons, restaurants to open with appropriate social distancing. There's a limit on gatherings of 15 people or less, and we're consistent now both in Wyandotte County, Johnson County, and across the state of Kansas. Pools won't be opening for a while, and some other things like parades, fairs, other things also are delayed now. But you can find all that information online about the Astra plan with KDHE's, Kansas Department of Health and Environment. One more, I think, Logan, or maybe a couple more. You'd advance.
And after that, we'll get into our questions. So
okay. Let me just jump forward to the Astra plan, just showing that it's today and that we really feel like it's going to help with confusion issues. The next one shows a couple things that are allowed and aren't allowed. Organized sports practices are allowed now. Fitness centers with social distancing are allowed now. Those kind of things. And that's it. Thanks, Logan.
And Alan, thank you for all your great work. It's been really impressive, just to say, and I think the Wyandotte is a different population. And next week with the senator, I think will be joining us. You'll be joining us. We have some other folks. We'll have a conversation about racial disparities and ethnic disparities here and what that means around COVID-19. Let's turn to the media first and see if there are questions that any of our media listeners have this morning for our guests. Somebody unmuting. Jill, what other questions do you have coming in from the public?
We have one for Senator Moran, and I think this would also fall for Dr. Greiner, but any steps being taken to further support nursing homes and long-term care specific?
Senator Moran, I know that's been a major issue across the country. We've talked about that a little bit. Anything new coming out of D.C. around nursing homes? I know there's already been a lot of attention paid.
There has been attention paid, and it is, in fact, in the CARES Act, support for nursing home and senior care facilities. In addition to that, the PPE, the personal protection equipment, I think that we've worked hard, a recognition that how important it is for the people who work at a nursing home to have that capability to protect themselves. We often think of PPE and we think of hospitals and surgery rooms, but this is important for lots of other people outside that hospital. And in addition to that, the phase 4, the next phase of legislation, is expected to include specific things that would be beneficial to senior care facilities and the people who work there and the people who live there. Dr. Greiner has had a lot of experience in this regard, as has Dr. Calendar Rich, also been a participant of your program. And I've learned from both of them about things that we ought to be doing. And we're involved in the discussion, trying to make sure that all the things that would be useful in further protecting us. Just as, it's a sad circumstance, particularly as our seniors, our parents, grandparents are socially isolated. I worry a lot about what that means to their health and well-being outside of COVID.
I think that's exactly right. But Alan, lots of attention paid to this issue, and I think one of the biggest things was to make sure that everybody had the right PPE in place and the right infection control standards in place.
Yeah, and these have been issues for a long time. I'm sure Dr. Hawkinson could speak to it too in terms of control of infectious spread in nursing homes. So it's not extremely surprising, but it's just devastating what can happen really before these facilities know it's happening. As you all know, we had a facility in Wyandotte that was really one of the worst hit in the United States over at Riverbend, but we put a task force in place about a month ago. Dr. Calendar Rich is chairing that task force. We've got multiple faculty here from the health system that are involved in that. We're now working in both Wyandotte and Johnson County, and we go to facilities, we provide consultation, we do some assessment of what their practices are, and then we try to establish kind of an ongoing relationship with them to help them promote testing and other things like that. There was even a consultant from the CDC that came here about 3 weeks ago, went to Topeka, was also here in Kansas City, visited some facilities and worked with us. And there's a little bit of new guidance out of CDC, I think, that's going to help us.
Yeah, we're going to hit that in just a little bit, because I think that guidance is really important, because what it really says is that it's not, countertops are dangerous, all that, do those things, but the real danger isn't there. It's not the virus floating in the air. It's direct contact from one person to another that makes the difference, which just says social distancing, wearing a mask, be safe, are the ways to keep all of us safe. And so, Chelsea, have there been any outbreaks linked to a community blood bank that you're aware of?
No, fortunately not.
And I think
we've been fortunate in that regard.
No, and that's just a really important point, because we can keep folks safe, and Dana worked super hard here in the health system to make sure that our clinic environment's safe. And Senator mentioned a little bit ago, and it's true, we've never been safer. I mean, if you think about that, the things we're putting in place now will help us during influenza season or during rhinovirus season or whatchamacallit virus. It doesn't matter. It's all going to help us.
Yeah, absolutely. We need to continue to do those things. So the CDC guidance says that it, may not be spread on the surfaces as much. But if you really look, I think that's the wrong headline. If you really look at what they talk about, is that it is thought to spread through surfaces. It is mostly spread through human-to-human contact. Certainly there's an article in Emerging Infectious Disease that talks about indirect spread through a mall. What they say is the majority is probably human to human or direct contact. They still recommend cleaning high-touch surfaces. That doesn't mean you can stop the adequate hand hygiene and not touching your face and things of that nature. You continue to have to do those pillars that we have been talking about, but it's probably less so. And again, this is a new infection. This is a new pandemic. We are still learning more and more about this every day.
Yeah, it's just really critically important. Other questions out there?
We have lots, so you just tell me when we can't do any more. Here's one that's more Memorial Day and weekend. Can I get COVID from someone dropping into like a bowl of potato chips or any kind of food? Should I serve
Memorial
separately?
Day. Yeah, Memorial Day sharing of the potato
inhaling
chips. Yeah. Memorial Day sharing of the chips. What do you think, Dana?
Our public health colleagues really grimace at the sight, at the thought
Did you just
of
cringe?
potlucks and get-togethers of that nature. Even though we continue to do that, those types of things are good for spreading all kinds of disease. I would say, directly onto the potato chips or something like that is probably not as significant as, say, a common spoon to, say, scooping mac and cheese. Overall, I think that sharing food and plates and drinks and things of that nature right now is probably a no-no and is probably really high risk to spread the disease. Dr. Greiner?
One of the things we're trying to promote is the idea if you live in the same residence with someone, you've probably, and I know you guys talk about the bubble all the time, you're probably in those people's bubble.
You're in a bubble.
And so you need to dine with the people you live in the same residence with. If it's others, even if they're part of your family and you've seen them occasionally with social distancing in the last couple months, it's probably not the best idea to have that buffet set up where people are touching the same utensils and then possibly afterwards touching their nose because it itches. We are talking all the time about don't touch your face, but people have trouble with that, and so do individualized meals if you're getting together with the family and you're social distancing in a group under 15. And I think that'll save lives.
It's inconvenient, but we talked about the rules of defensive driving a couple of days ago, and I did my ICU rules yesterday. Alan may remember some of my ICU rules, but one of them was sometimes it just takes time. And what that really means is that it takes a while to work through disease and then to get better. And I think we have to look at that as a society, that if we just continue to do and make good choices now, that as we come on the other side of this, as we get better therapy, as we have vaccination, which it turns out we're getting really good news about, as we get vaccinations established, then we can go back to more common things and our ability to go to a buffet or to share a dip. But in the meantime, we have to be super smart. I do wonder, though, the high salt content of a potato chip may be a little bit of a preventive measure, Dana.
Yeah, maybe. I think, again, we really haven't seen specific foodborne spread. That's not what this is. So even if you are, say, eating it or it's on the chip, it's still going to get down into the stomach. It's not again, it's more of a respiratory rather than foodborne, and so that's the whole thing about it. But that could probably be a potentially difficult environment for the virus to survive into.
Yeah, but I think it's about that person-to-person spread. So be smart, folks. We can do this. It's not the end of the world.
What about arthritis medications and medications for Crohn's? Does that provide any benefit in suppressing the cytokine?
Yeah. So, Dana, what do you think about the benefit of some of these meds to patients?
That's a thought, because we talk about the immune dysregulation, the cytokine storm, the inflammatory process that comes probably because your body, is able to clear the virus itself for the most part. And then it's everything that comes after. So they have looked at patients who are either have lupus or rheumatoid arthritis who have been on chronic hydroxychloroquine. They've looked at a case series. So that means a number of different patients. They found that those patients weren't at any higher risk or lower risk of developing disease and severe outcomes than somebody who's not. We've also had other case reports of patients who are on immune suppression for one thing or another, say kidney transplant or liver transplant, and there's no really consensus that you are either at more risk or lower risk of developing disease and severe disease. So this is another one of those aspects where as we move forward, we will get more and more data. But right now it doesn't seem like it necessarily will provide protection from any of that.
It still comes down to being socially distanced. And Senator, I've seen pictures coming out of the House or the Senate with people standing further apart and wearing masks and doing things. Talk a little bit about how life has changed in the United States Senate as a result of coronavirus.
Yeah, who would have thought that what we wanted in our Congress is for us to be further apart? Keep hoping we can get closer together. But this is, in some ways it has brought us together in a sense that we all have a common mission and there's a general desire on the part of members of Congress, public officials to solve, to resolve, to improve the circumstance. And so, the time of challenge means that people, at least to some degree and often arise to the occasion. But it is different. When we have a policy lunch in which senators gather for lunch, but we are now in an auditorium-sized room with large round tables and everybody separated during lunch. We vote. Normally, a vote in the United States Senate is a 15-minute opportunity. You walk from your office to the Senate floor and vote within a 15-minute time frame. That's been extended substantially, and only a few senators to be on the floor at the same time, again, separated. You see in the news, and it's pretty prevalent, senators wearing masks. The House has not really, they've not met except for one day. We've been in session for the last 3 weeks. The difference could be that there's 435 House members and only 100 senators, so a bit easier for us to distance. The hearings that I talked about earlier have been done with web and technology. So I'm in my office on my laptop participating in the hearing, asking the witnesses who are also distanced and providing their testimony generally by technology. So it is a different thing. That the House has passed some rules to allow the House to vote without a physical presence. The Senate is more reluctant to do that, and still trying to figure out how it is we do our jobs. But I'll go back to what I said with a smile in the beginning. There is talk about allowing members of Congress to vote electronically. I think that makes some sense in today's current environment. But we really do need things that bring us together in general. We need things that, if we spend less time with each other, if we don't know each other, if we don't have the conversations that lend itself toward a dialogue that gets us to a place that's satisfactory to a majority of members of Congress, our jobs become more difficult at a time in which the country's already pretty divided about things.
Yeah, I echo those comments, and thank you for your leadership in that bipartisanship, Senator. And in the words of Aretha Franklin, who's zooming whom? It's the best. All right.
Dr. Greiner, do we have enough staffing for contact tracing? What do you need?
So contact tracing has been a big issue. As most of us know here, I think we know that testing goes right hand in hand with contact tracing. If you can't do both with enough manpower to get the job done, you're not going to contain the disease. We know that there are some counties here in the metro who are struggling with that. There's been a lot of federal dollars that have come in, and we thank the senator and others for that. But some of that money isn't being spent yet, and folks are trying to hire contact tracers. We put a volunteer program in place that's allowed us to get to some of the benchmarks for our population. They recommend 15 to 30 per 100,000 contact tracers. So in Wyandotte, we need about 45, and we have that because we've had some faculty from here that weren't seeing as many patients,
medical
and some med students.
I mean,
and
nurses.
It's been great, but we know we've got to hire more full time as well. What they do is whenever there's a positive test, they make a bunch of phone calls. They figure out who needs to stay home for 14 days, and they provide a ton of education. So it's a super important service. We really got to keep increasing the numbers of people doing that, and it's going to go on for months, if not a couple of years.
And could you explain, is that done by phone, and where do they go if somebody wants to volunteer and be trained?
It is done by phone. There is a little bit of evolving technology around this, and there's actually some local initiatives to promote some text-based interaction that could happen with contact tracers and some of the patients and their contacts. For volunteers, of course, on our website here at the health system, I know there's a volunteer tab. We also have one at WyCo, kck.org for folks who want to do things in Wyandotte. They can go there. They can mention that they're interested in that. And I also know that at the state, at Kansas Department of Health and Environment, Dr. Norman's trying to get a staff of about 400 volunteers trained up. And the training systems are great. We've all gotten our volunteers through it, and it really is a great system to get people up to speed, and I think the community really appreciates it.
They do, and I think a shout out to members of the medical system. I know we didn't have as much work to do when we closed operating rooms and clinics for a while. Some of our nursing staff and other parts of our staff actually went to different counties and to KDHE to do contact tracing, and it's really another sign of community pulling together to help work together. And I think that's how we get through a pandemic crisis, all of us showing social responsibility. And we need to extend that to our community blood bank, because clearly, as an ICU physician, I know how much we depend upon the community blood bank for a healthy supply, Chelsea, and really as a form of treatment. Tell us again, how many donors do you think you could use over the weekend to try and get our blood supply back up?
600 every day. That's
wow.
what we need. So
had
daily we need 600 units collected across Topeka, Kansas City, and St. Joseph in order to adequately supply our hospitals. So it's a big ask. we need it.
And you all have been working with national experts and others to make sure that that environment is safe for donors, because that's 600 people coming through one of the either a blood drive location or coming to one of the blood banks to give blood.
Yeah, and as to your point, you mentioned earlier that KU is probably the safest it's ever been. And that's the same for the blood center, and that's the same for our blood drives. The amount of safety protocols that we've implemented over the past month or so, I mean, we really are the safest we've ever been. We're working diligently to make sure these locations are safe and controlled environments so that donors don't have to worry about it.
Yeah, and I saw you shake your head yes when we were talking about that, and it is true, Dana. We've never been a better, safer, cleaner environment.
Mm-hmm.
I have a reporter question. This is Mary from the Wyandotte Daily asking, and it sounds like this might be for the senator. What is the latest on Congress appropriating more funding for cities and counties which have been drastically affected by the closing of businesses and lack of tax revenues?
Senator, any new news around that, the question of cities and counties being able to get any more aid?
News is that there's work at developing a consensus of what to do in regard to this phase 4, which I think we began serious deliberation post right after Memorial Day. So this is a June timeframe issue as far as legislation, but the conversations are serious about what that should look like. I've said previously that I'm not interested in the Kansas taxpayers paying for mismanagement of states over a long period of time, but we have an opportunity to help, and the needs are great in regard to response to COVID-19. So this is not a, quote, bailout for states and communities who've mismanaged their finances, but there's a lot of circumstances where the loss of revenue, tax revenues, and the increasing expenditures for emergency preparedness, for public health, for law enforcement has increased. So particularly our cities, I shouldn't leave out counties because each one is different, but those who rely more on property taxes have less of a consequence than those who rely on sales tax. So it's different from across the country. Mary, this is a really good question. It is probably the most significant issue that we will address in figuring out what the next phase of legislation looks like. In the meantime, I'm on a cause of trying to get more flexibility for our cities and counties and the states. In the state of Kansas, with the exception of Johnson and Sedgwick, all the federal dollars under the CARES Act came to the state of Kansas. So $1.25 billion, some amounts carved out for the two most populated counties in our state from that money. But then the question is how that money can be spent. And currently the law requires it to be spent only on the cost of COVID, personal protection equipment, testing, law enforcement, those kind of direct expenditures. And my view is that there is a lot of other things that may be in many circumstances may be more money than can be spent exactly on those items. And we ought to give our states and communities the opportunity to have the flexibility of deciding how best to spend the dollars that have already been appropriated. Again, this is an issue that is important today. There's money that is not being spent. Let's get it to the place in which it is helpful. And it will take a long time for our country's economy to recover. And we will work continue to work as we face a desire to pass legislation in June. Excuse me for stuttering. But it is the topic of deliberations, trying to find the right way. And we don't have we ought to also say that the federal government just can't continue to have all the money it takes to solve all of the problems. We can't. This is taxpayer dollars, and it's certainly taxpayers in the future because most of this money is being borrowed. But there is some responsibilities that we have today, and we're going to try to figure out how best to do that. Important issue. Whenever it gets a chance, and you have no question, I have one for the panelists. While I have a great staff, I don't have 3 doctors on my staff.
Go for it. This is your chance.
So, one of the things I think I'm so hopeful about, and so I think is so important, is classes in the classroom come fall. And I've had conversations with school superintendents across Kansas. I'm on the phone with them. I've talked to university presidents, community college presidents, technical college presidents, and this issue of testing. I'm of the view that if we can figure out by testing who is positive, we can isolate people who are positive and allow more freedom to people who are not. A question that I've been asked on several occasions is, but a test is only good for one day. So what is the value of the test? I'd be delighted to know how to explain how testing helps us get to what I just described. Or if you want to tell me that I don't know what I'm talking about, that's a satisfactory answer too, and I'll start over.
Dana and I will take that on, and we'll get Alan to pipe in too. Just though, a quick note, we're going to address this exact question on Tuesday when Doug Girard, the Chancellor of the University of Kansas Health System, and Jeff Long, the Chancellor of the University of Kansas. Wow, did I just say Doug Girard's the Chancellor of the University of Kansas Health System? Hope you're not listening right now, brother. Doug Girard, who was a physician here and a good friend of mine from the University of Kansas Health System, but is the Chancellor of the University of Kansas, will be on our program to talk about reopening the school. And Jeff Long, Athletic Director at KU, will be joining to talk about the reopening of college sports. So that'll be a really important topic. I know many of us who are kind of sports fanatics, and you probably know that about me by now, are looking forward to that conversation on Tuesday. So Dana, you're actually on the task force working with KU. We're both on the task force looking at reopening the University of Kansas at Lawrence. Talk to us a little bit about what does that one day of testing mean, that one point in time?
Yeah. So absolutely. So the test that we use to look for acute infection, if you have the virus, is a PCR test. It's true we say it's that one point in time. We can sometimes fudge to say it's 48 hours or possibly even 72 hours. But we have to understand, why is somebody getting tested? So if somebody has symptoms, obviously we are going to test them. The other aspect of that is if you are coming into a certain facility or a certain program, just as if you're an inpatient admission here at the hospital, are you going to get a screening test? That's one other issue. The other issue, and Dr. Greiner can speak to this, is then testing people who may be contacts, and this goes along with the public health contact tracing. And so there are various reasons to test, but we have to understand why you are testing at that point in time. And that's for the PCR test. The other test that is slowly coming up, and the technology is getting better, but we have obviously seen a report on ABC News about a study that was done at Mayo Clinic that's saying some of the antibody tests probably are not as accurate as they have touted to be. In fact, some of these have been false positives. I think they even tested saline and found that they got a positive result. So some of these antibody tests are still not validated and vetted appropriately.
Pulled off the market now that have been out there being used, and people being told, well, you have antibodies. The reality is, well, we don't know what you had an antibody to.
So the actual best test we have right now is the PCR test, and the test here that we use at the health system is very good, very sensitive and specific. And so that is basically the gist of the testing. So is the test good for that one point in time? Yes, but we also have to understand why somebody would be tested. It's either for acute illness, it could be for just a screening purpose, whether you're coming to a facility or you're coming into a program or something of that nature, like a sports program, or you're doing contact tracing. And I don't know if you or Dr. Greiner would like to comment
Alan,
more.
any comments? And this will be kind of our wrap-up, too, today, because we're winding down. So
yeah, it's a great question, Senator, and we're seeing all kinds of interest in this issue. But I feel like in a lot of our public health settings, it is only good for about one day. I don't think we should be testing people who we need to move from the hospital here and have recovered and haven't had symptoms for 14 days before they go to a rehab facility. I think it's not of any value. We know that people can test positive on the PCR and not really be infectious. So you might be 21 days out from recovering, and in some of the studies you're still testing positive, but you're probably not going to infect anybody. You don't need a negative PCR to go back to work either. So we're pushing that with local employers. I do think the antibody testing is getting better. I was talking to Dr. Tilzer from pathology last night, and he feels like it is. I saw some data from Sweden, and this is a problem. In Sweden, they're doing a bunch of antibody testing, and it looks like only about 7% of the population is showing antibodies now, even with their wide-open, no stay-at-home approach. And because of that, Senator, I don't think, even if we have good antibody antibody testing by August, I don't think it's going to help us get people back to school. I think we're going to have to use other strategies to determine what the risk is and put new procedures in place to really help us know who might have had an exposure. If we do great contact tracing in the next 2 or 3 months, I think we can know where people might have been exposed and kind of create algorithms without having the best testing capacity or the best technology. But hopefully by next fall, winter, we'll have all that, and then we can really get serious about doing both PCR testing and the antibody testing that shows us who's been exposed.
Yeah, and so I'm just going to pile in here a little bit. You know, medical tests are never good or meaningful when you look at them in isolation. It's because testings are not diagnosis. They don't replace a history. They don't replace a physical exam, and they don't replace trying to put all the pieces of information together. I think what's happened with testing is we've heard so much about it, we've decided that testing is really the holy grail. And that's not right. The truth is that testing is really important to help prevent and control the spread of the disease and to make a diagnosis in somebody whom you have questions about. You have to have thought, well, I have some I have some probability in my mind that this person could have SARS-CoV-2, and I want to verify that. Testing makes perfect sense then. But to randomly test everybody coming onto a college campus and think that it means much for the next month, no, that's just not true. Because what happens is people could become infected or come back in contact. That's not what people want to hear. They want to hear that testing is a holy grail. Testing is incredibly important for the reasons that we've talked about today. It helps with trying to figure out if you have it, who have you been in contact with, how do we isolate you? But what it doesn't do, it doesn't give you all the answers. It by itself can't tell us if it's safe to open up a college or not open up a college. What it can do is tell us if somebody's sick in a dormitory and they have SARS-CoV-2, what do we need to go and how do we respond to that? That's what testing does. At least that's what the PCR testing, that is the nasal swab that you've heard so much about. Well, this is a big day. This is a big day because we're heading right into the Memorial Day weekend. Chelsea, final thoughts this morning.
Final thoughts. We need blood now more than ever. We had issues trying to get blood donors in the door before COVID-19 happened. So we're definitely struggling now just as much as I think you guys are to try and get people in your doors. So we just encourage you to, if you feel comfortable, come in and donate blood. Make an immediate donation to donate because we need, like I said, 600 people every day.
You should feel comfortable. Y'all are safe, just like we think we're safe. I know in our chief medical officer calls across our city, we all think we're pretty darn safe because we've worked so hard at being safe. The worst thing a health system can do, community blood bank can do, is to make somebody sick because you came to see us. That is just not something we want to have happen. Senator, any final comments or thoughts for this morning?
Virtual opportunities to celebrate Memorial Day, to honor those who served our country, those who died. I'll participate in one at the World War I Memorial. It's a virtual presentation on Memorial Day, the museum in Kansas City, starting at 10 o'clock, and then 11:50 Fort Riley, a virtual Memorial Day ceremony starts at 11:50. So there are opportunities for folks who are accustomed to visiting the cemetery and visiting the graves of their loved ones to participate in a ceremony that brings Kansans and Americans together. And I guess my take for Chelsea would be, as we celebrate, as we respect, as we honor those who served our country, there's an opportunity for us to serve today. One of them is to be able to provide blood for those who need it across our nation.
Well, you want to make a difference, give blood. Thanks to all of our listeners out there. Remember that as you celebrate Memorial Day and have a great time, a special shout out to all those veterans and folks who have served before. Like the senator, I never held that distinction. My father was in the U.S. Navy. My brother was in the 101st Airborne in Vietnam. And I know they were really proud of the things that they were able to do and to the achievements and the work they did for the United States. So please stay safe. Remember, the best way to do that is what we say every day that makes you feel like you're right here in Kansas. There's still no place like home. Have a great Memorial Day weekend. Stay safe out there. We'll talk to you next week.